When a patient comes in for her first visit, we're going to do a history, and we're going to get all of the background information on the patient and her partner. We want to know things like, what is her menstrual history? Does she have regular periods? Has she ever been pregnant before? Does she have any family medical history? That's a big one because that's how we assess some genetic risks. We want to know all the questions about her partner too, regarding medical history, surgical history, medications, family history, exposures to anything that would impair fertility. So it's really a long conversation all about you, which means you know all the answers. We just want to get them down and think about them in an organized manner. Once we have the history completed, we're going to determine what diagnostic testing we are going to do. In order to determine someone's fertility status, you need to check on the uterus, the tubes, the ovary, and the sperm. And so in looking at all of those, we get a semen analysis on the male partner. For the ladies, we're checking an egg count on the third day of her cycle. That's done by an ultrasound and blood work. We're looking at a test to examine the inside of her uterus, which is typically a saline sonogram, a combination of a little water in the uterus to see if there's anything in there. And we check tubes by making sure that there is fluid that flows through them on both sides to show that they're open. We also do blood work on both partners to make sure they're generally healthy and there's nothing else we need to pay attention to, like infections or diabetes or anything else that would impair getting pregnant or being pregnant. After we have all the diagnostic tests resulted, we're going to sit down at a visit and go through everything from top to bottom. When we do that, we explain all the results, we talk about what they mean, and then we go through what is the appropriate treatment or treatment options, because sometimes there's more than one, and go through those in detail so that you know what the potential success rates are, what the process is going to be like, and then we make a decision together about how you want to proceed with getting pregnant. Sometimes the hardest part about any fertility treatment is the first call to make the appointment. We are here to support patients and to help them get through this from beginning to end and do whatever it takes to help someone build their family.